So good morning to all of you. Usually when I show up at an event, there is sort of slumping of shoulders and people realize that the really tall guy with the mustache who plays guitar and is a geneticist isn't going to be here. And Francis does apologize for not being able to be with you this morning, but he did want me to share with you his personal congratulations and greetings. I'd like to say that one of the things I learned in preparing for this brief introduction is you should never, ever search the internet using the terms interesting ways to celebrate your 20th birthday. Don't do this. I won't say that it was enlightening, but it was eye-opening. So be very mindful of the search terms. You need to use precision. And speaking of precision and clear language, let me congratulate all the behavioral and social scientists, researchers, and members of the staff here today for your creativity, your diligence, your resilience, and perhaps most importantly, your perseverance. Over the past number of years, we've heard from too many people, many of whom have tried to deliberately twist and contort the terms or language used in some research studies, either to oversimplify at best and at worst to somehow misrepresent very important scientific pursuits. And we wanted you to know that NIH stands with you. We've gone on record numerous times to defend behavioral and social science as a crucial discipline. We feel very strongly about this, and we plan on continuing to tackle this. Many of these attacks have used exaggeration and hyperbole to draw media attention. For example, one of my, I don't know if I'd call it favorites, but one that comes to mind is the NIH funding research on, quote, cigarette smoking detecting underwear. By the way, the actual grant, the development of non-invasive monitoring systems for cigarette smoking, was creating and testing wearable respiratory and hand movement sensors that via pattern recognition could detect each episode of smoking in real time. And so very few reasonable individuals would question the potential value of such a device, but unfortunately the oversimplification of the grant title grabbed the headlines and then undercut the actual merits of the work. And so it requires a redoubling of public education and communication and something that all of us together need to do. So I think that just to slip in a short but important public service pitch, okay? Dr. Collins and I want to encourage the behavioral and social sciences community to continue to propose rigorous and impactful research that is, just impossible to attack, You're doing a great service both to public health and the general body of scientific and medical knowledge, so continue to be creative, keep bold proposals coming. Your ideas, your knowledge of health and disease and what we gained from your studies is essential. Now, I think it's probably appropriate for me to acknowledge the three core elements of the bold vision that OBSSR has set for itself. Next generation measurement and data, influence on population health, and training the next generation of behavioral and social scientists. I mean, each one of these alone would be sufficient, but obviously taken together, this is a very powerful package. This is a very powerful set of objectives to realize. If you consider the anniversary theme that's being displayed here, healthy lives through behavioral and social sciences, the three elements of the OBSSR's vision align perfectly with the NIH vision. And obviously, this mutually advantageous integration is playing out in real time as we outline NIH's integral role in the President's Precision Medicine Initiative, particularly in the areas of measurement, big data, and of course, next generation training. Important, perhaps more broadly, are OBSSR's goals to foster additional and deeper collaboration of the biomedical, behavioral, and social science communities to address the very complex and pressing health challenges that face our nation. Now, you all know this implicitly. Behavior matters. You know, you'll hear this statistic a lot today, and I'm not telling you anything that you already don't know, but I believe it needs to become part of our national mantra. You know, about half of all premature deaths are attributable to behavioral and social science factors. That's a stunning statement when you think about it. Half of premature deaths. Now, you know that. The question is, but let's not keep that a secret, right? We know from NIH-supported research that evidence-based efforts for smoking cessation, back to sleep, anti-HIV/AIDS efforts, the public health efforts in behavioral and social sciences play seminal roles in addressing behavioral and social determinants of health. And so please never forget that all of you and members of the community at large are really making an extraordinary difference. Talking about cancer, heart disease, infant mortality, global AIDS prevention. Can I slip in dental health also? Okay. I wasn't in there, but I just put it in there. You know, the impact is of course, it has to be obvious to everybody. So, you know, we in the scientific research community know that behavior matters. And no matter that it's often terribly complicated and difficult to fathom, just because it's complex doesn't mean that you shouldn't be tackling it, and tackling it with the most sophisticated, most advanced approaches possible. We appreciate the work of OBSSR, and to each and every one of you who help us meet the mission. We thank OBSSR for 20 years of outstanding leadership. We want to thank you and all of your collaborators to help move the office forward. Now I'm going to segue right into my second chief responsibility this morning. And it's my pleasure to introduce someone who is very well known at NIH as your keynote speaker today, Dr. Alan Leshner. Alan, I read this and I didn't believe it. It's been more than 10 years since you were an NIHer. That's, wow, where did it all go this time? But let me quickly reacquaint some of you who may not know that side of Alan. He served at NIH as director of the National Institute on Drug Abuse from 1994 to 2001. While here, he also served as deputy director and acting director of the National Institute of Mental Health. Now, in December 2001, for some reason, he left and joined this organization, American Association, the AAAS, of course, as CEO and as the executive publisher of the journal Science. I think that there's a lot of other stuff here, Alan, but, you know, he's an elected fellow of the AAAS, the National Academy of Public Administration, the American Arts and Sciences, member of the Institute of Medicine of the National Academies, and serves on its governing board. He's also a member of the National Science Board, first appointed by President Bush and then reappointed by President Obama, so that's pretty cool. I think for all of us at NIH, we feel like Alan never really left because he was so much a part of the fabric of this place. I want you all to join me in welcoming Alan back to NIH.